Hey everybody, it's Dr. Michael Hyland, Hyland Physical Therapy and Wellness, and you're watching Leave the Falling to the Leaves for Wellness Wednesday. Today we're discussing peripheral neuropathy, and the two topics we're going to really discuss today are going to be, number one, why having diabetic peripheral neuropathy or other types of neuropathies puts you at higher risk of falls. And number two, what can be done to decrease fall risk while living with neuropathy? So, in answer to question number one, why neuropathy can cause you to be at higher risk for falls, we need to talk a little bit about your systems of balance, okay? So, there are three main systems of balance that the human body uses to keep in balance. Number one is your vestibular system, and that is found in the inner ear on both sides. Your vestibular system tells your brain and your body information about kind of direction of movement, whether your head's turning or whether it's still, whether your eyes are still or whether they're moving, all kind of information going on there. But that's one of the number one balance systems, and also one of the first to decrease as you start the aging process. And we'll talk a little bit about that too. Number two is vision. We use our vision for balance a lot because our eyes give us reference to the world around us, whether other things are moving, whether we're moving or staying still, etc. And so, and also just using our eyes to look for obstacles in our pathways, or making sure that the ground is level, things like that. These are just small examples of how each system works. Number three is the system we're going to be talking about today with neuropathy, and that is the sensory system, the proprioceptive system. So proprioception is kind of a big word, but essentially what that means is your ability to feel your position in space. And proprioception takes many forms. It could be the movement that you feel in your joints, or it could be the pressure that you feel on the bottoms of your feet, or pressure. Every part of your body has the ability to feel that. So if I'm leaning on my, let's say I'm leaning forward on my elbow on my thigh, I can tell you that based on the feeling that my elbow is pushing into my thigh, I can feel that through my elbow and I can feel it through my thigh. And I also have pressure on my chin and I can feel it both directions. So that's proprioception. That's, pressure, deep pressure or vibration, feeling something or feeling the position of your joints as well. So for instance, I can tell you with my eyes closed whether my hand is up or down, or my finger is closed or pointing up. I can feel that without looking at it under normal circumstances. The reason that peripheral neuropathy or other conditions that cause you to lose feeling cause you to be at higher risk of falling is because you're down to two main systems of balance instead of three. And to be really technical here, what's up, David? You're watching live, brother. To be technical, there's actually four systems of balance if you include your cognition, your ability to be aware of what's going on. But we're not going to get into cognition. Mainly, we're just talking about the three balance systems that are physical in terms of senses. So, peripheral neuropathy causes you to lose the ability to feel position in space, to feel pressure in your feet, etc. And typically peripheral neuropathy affects the lower body most of all. It can actually affect the upper body too in terms of the hands, but for the purposes of fall prevention, we're talking about the lower body. So what can be done about that to decrease fall risk while living with that condition? You can't bring back what's not there. So if the nerve endings are dead because of damage due to diabetes or other conditions, then those nerve endings probably aren't growing back. However, if you're exercising regularly at trying to kind of reverse some of the conditions, That's great, so keep that up. But one of the things you can do is to enhance the ability of your other two balance systems to kind of take over for the one that's lost. So making sure that your vision stays good, and in other words, you're getting regular eye exams. If you have other conditions that cause you to have low vision, try to get them taken care of, cataracts and things like that. Keep your vision strong, and the number 2 thing I would recommend is you want to keep your vestibular system or your inner ear system challenged. And so I was going to show you a couple ways to do that. You can do that in your home today, tomorrow, whenever you choose to do it. So if you're, I would actually recommend doing this near a kitchen counter or some place where you can actually have your hands. You can do it with a chair as well. Sorry for the rolling sound. But you're just going to stand and attempt to do it with your hands at your side or crossed. Just have your feet about shoulder width apart to start out. Just focus on standing there on a solid floor and then close your eyes. This can be really scary for people that have problems with the inner ear, especially when that's combined with not being able to feel your feet. Because you're basically down to one system, and that system may not be working very well. Especially if you're over 65, those nerve impulses tend to slow down. It's like a muscle though, if you work on it, it will improve. So if you can do this for 30 seconds, you're probably doing really well. So try to do it. The next challenge would be to put your feet as close together as you can and try to hold that for 30 seconds at a time with your eyes closed. You may feel some movement, and if you have peripheral neuropathy, you may not feel it as much. So you may actually end up losing your balance. That's why I want you to be close to something like a counter or a chair, back of a chair. Once you can do that safely, and you know you're not going to lose your balance, I would absolutely start on a solid floor with shoes on, or even with shoes off, but definitely with shoes on because you're going to have better support of your feet. The next step to that would be getting a pillow or something similar that's soft and squishy and trying to stand on that with your eyes open without losing your balance, and then with your eyes closed. So there's kind of a natural way to progress that. Hope that's helpful, and this is just one thing that can increase fall risk, but neuropathy is definitely a big problem in the United States and other countries, but especially in the U.S. with all of the incidences of diabetes that we have. So if you know anybody that has diabetes, share this information with them, and be sure to look for the video as it drops on YouTube. I will be sure to post a link to that at some point once I get it up. Thanks for watching today, David, and I see that Bryce is joining me live. Thanks for joining live and for your comments. And I will look to see you next week on Wellness Wednesday, and leave the filling to the leaves. This is Dr. Michael Hyland with Hyland Physical Therapy and Wellness. As always, be empowered.